Minimally invasive surgery simply describes a technique a surgeon may use to perform a surgery through small keyhole-type incisions. There are a variety of minimally invasive surgeries, and when we're talking about kidney cancer, it most commonly applies to radical nephrectomy and partial nephrectomy. It's a tool we use during minimally invasive surgery to perform the task at hand. So we're doing essentially the exact same surgery as we would with open surgery, just through keyhole incisions. The robot facilitates more complex maneuvers by the surgeon. The robot has several components. So there is the actual robotic cart with the instrumentation that's hooked to the patient. There's a vision cart, which has a computer processing unit and a high definition screen. And then the surgeon actually sits at a console, usually an arm's length from the patient, and is doing the surgery in the console by manipulating end effectors, which then allow the robotic instruments to do that task inside the patient. The surgical robot that we're using can actually scale our movements, and it basically miniaturizes our hand down to about 7 millimeters in size. So you can do complex tasks, and I can be actually more precise than I can be with my own hands during open surgery. In my opinion, robotic-assisted surgery is as safe as any other type of surgery. It does come down to the experience and the judgment of the surgeon. So when there are complications, it's related to patient factors, sometimes tumor factors, and sometimes surgical factors. The robot has no increased risk above other standard operative risks that a patient would be subjected to. There's always the potential during minimally invasive or minimally invasive robotic surgery to have to convert to a standard open operation. There are instances where there's difficult dissection, inability to properly cut out the entire tumor with a clean margin, or instances of bleeding or injuries to other structures which may then warrant conversion to open surgery to complete the operation. That risk is low, but it is present in all cases. Robotic surgery is not for every patient. There are reasons why we cannot perform robotic surgery for some individuals. Examples include prior surgery in that area of the abdomen can complicate things and make it much more difficult to do minimally invasive surgery. There are factors with a person's kidney cancer that may preclude using a minimally invasive approach and warrant a standard open surgery approach. One of the great advantages of the robot is a small wristed instrument, which is fitting through the same portal. So that gives us an advantage. Another advantage with the robot is three-dimensional vision. So the surgeon actually is able to see depth, which is lost in standard laparoscopic surgery. The robot does facilitate reconstructive maneuvers during surgery. It basically allows us to sew in a very straightforward manner, a manner that's intuitive to the surgeon. Laparoscopic reconstruction is difficult to do, and it's a high complexity task. There's really no difference in the anticipated recovery with minimally invasive surgery, except less pain, likely less risk of a wound infection. Certainly during surgery, bleeding is less likely to occur with minimally invasive approaches, although partial nephrectomy is a procedure where there is a significant risk of bleeding, generally about a 5% risk, but that does vary based on case complexity. The minimally invasive approach, both standard laparoscopic and robotic surgery, there is less damage to the tissue, so people do tend to recover faster, resume their normal activities. There's a number of questions a patient can ask. For example, what is the clinical stage of my cancer? In other words, how large is it? How complicated or involved is this tumor? Is there a need for reconstruction of the kidney, which is performed in partial nephrectomy? Surgical robotics helps with that for surgeons. So another question a patient could ask their surgeon is, do they qualify for surgical robotic approach, and would there be an advantage? And the surgeon's experience will come into play. It's not for everyone, and it may not be offered for everyone. So it is something you can ask. If the surgeon doesn't perform robotic surgery but deems it appropriate for this patient's case, could the patient be referred to another surgeon who does have access to surgical robotics? So another question a patient could ask their surgeon is about recovery time following the proposed surgery. Typically, open surgery does require a longer recovery than a minimally invasive approach. So as with any surgery, trying to eat well and exercise is important. It's a term we call preconditioning for surgery. If someone is a smoker, they should try to stop smoking, which would greatly benefit their recovery. There are other aspects to the preparation for surgery, such as mental health and anxiety. So Kidney Cancer Canada provides support and education for patients. The patient's family doctor and surgeon may also provide support. There may be instances where someone needs a stress reduction program or other things such as mindfulness and meditation, yoga. There's a number of different things that have been proposed, and they do seem to help people.